Thank you.
Yeah, I just made, Alina, do you need me to make you, or you're already a host?
Okay, we're good.
Am I?
Sorry about that. Some weird
No, it's
technical
okay.
difficulties.
That's okay. Let me share my screen again. Oh,
And Alina, you're
no, I
Were
good.
you
can't share
I'm
able?
my screen.
recording it now.
Oh, okay. Okay. Good. All right. Thank you.
And
Sorry
can
about that.
someone make, no, it's okay. Can someone make me a co-host? Because I am not able to share my screen now.
There you are. Oh boy. Yes. This thing is just not nice.
I don't know why it's
There you
doing
are.
that to us.
Now.
Let's try. Oh, perfect.
All right. Thank you.
Yeah, are we back in business, guys?
Yes, we are.
Okay. So I know this is a pre-health club, so I don't. All my anecdotes are about PA school specifically. I just wanted to put this in here for anyone that maybe didn't know fully about the PA track or the pursuing a career as a PA. So I left these infographics up here for you guys. I won't really go over them. Overall, this is pretty comprehensive as to what PAs are, at least as an introduction to it. I didn't know what a PA was until my sophomore year of college. So if that's kind of where you're at, don't feel discouraged and don't feel behind in that. So, but I left this up here in case any of you guys wanted more information about that. So let's talk about the application process, guys. CASPA is the service that you guys will use to apply to PA school specifically, and I included that link in here. I mentioned that the cycle typically opens in late April. I don't think that they have. I looked when I was grabbing the link, and I don't think that they have um, the newest date for when the cycle opens. But I think the current cycle closes like April 16th or something like that. But it's pretty consistent every year as to when you can time the closing of the first cycle and the opening of the next. They're usually separated by about a 2-week period. So one thing I really want to harp on, guys, is the timing of the submission of your application is highly important. That is probably equally as important to medical school and nursing school, I'm assuming, but I know for PA school specifically, because it's just such a competitive process, that timing is incredibly important. So everything you need for your application, I'm going to hit all the points of what you guys will need. But if the cycle opens at the end of April, say April 31st, my best recommendation to be the most competitive is to have your application sent off by the first week of June. And I know it seems like a pretty quick turnaround, but a lot of these schools, actually the majority of these schools, have what's called rolling admissions, which means that as they're accepting or as they're getting applications, they're sifting through them and they're offering interviews on a as received basis. So say, for example, the application deadline wasn't until September, but someone started, all these applicants started applying in June, July, August, and they've given out all of their interview dates and they filled their class by August, then they'll be done. So it wouldn't have mattered if you had waited until that September date to submit your application because they already filled the class. So that's why it's so important. It's also important because I know at CASPA, after you complete your application, even after you've selected all the schools that you want to apply to, as soon as you click send, it doesn't automatically send the application to the schools. You go through a verification process. So, and that can take from a couple days up to about 4 weeks. Actually, my first time, I was a little late in applying. I think I submitted my application at the end of July, beginning of August. And it took 4 weeks for my application to get verified. So if you're not careful about that timing, you could miss deadlines because you didn't factor in that time for verification. So do be wary of that too. The longer you wait into the application cycle, the longer that verification process is going to be, and you would hate to miss deadlines. Okay. I didn't mention this on here. I'll talk about it a little bit later about my suggestion for applying to multiple schools if you have the means to do so. One thing I want to hit on, diligently read all the prerequisite requirements for the programs you choose, guys. That means how many healthcare hours? Do they have a requirement on healthcare hours? Is there a number that they suggest? Is there a number of volunteer hours? Your prerequisite courses, do they accept AP courses or dual credit? So make sure that you're checking all of those diligently, because you would hate to pay for an application just to have it immediately rejected because you didn't check all the things, which actually happened to me the first time I applied to Rush. My first cycle, I did not see that they had a minimum requirement of healthcare hours, and my application got completely rejected. And that's like $125 down the drain. So be wary of making mistakes like that. As far as the GRE goes, that's going to be the standardized test you guys use for to get into most schools. I'm a little bit older now in my second year of school, so they're actually apparently using something, and I didn't include this. I'm sorry, guys. They're using something. Some schools are using the PA-CAT, which is the essentially the PA version of the MCAT. As far as I know, I think Rush may be using that, and I don't know to what extent that factors into your application, unfortunately, because that's something new this year. A lot of schools are using that also as an addition to help pad your application in the face of COVID, and just help add another element, considering a lot of students have maybe marked a pass fail in a course, and they want to add something more to their application and do well on this PA-CAT test. Unfortunately, I've never taken it. I don't know much about it. I wish I could offer you guys more intel about that. But if you just Google PA-CAT, there's actually a sample test, I think of like 15 or 20 questions, and that can give you an idea of what that might look like. So for the GRE, it's essentially the graduate level SAT. So you take the SAT before you get into college, and you take the GRE after to get into grad school. So it's essentially just a glorified and more difficult SAT. Same type of subjects, math, English, and reading, writing, language. I'm sorry, it's been so long, guys. It has all those same subjects, and my personal recommendation is that a score over 300 is generally what schools define as making you competitive. So you can actually take the GRE, I think, every month. It might even be shorter than that. So check on the GRE website, because if you don't do well the first time, I think you can take it 2 to 4 weeks later. So I would monitor that, guys. I used Magoosh, and I started studying about a month before my GRE. The Magoosh was great because, and it is a paid service. I'm sorry I didn't mention that. So if you need to split that with someone, or if you're able to, I think it's highly worth it. I wouldn't suggest it if I didn't think that that it would be really beneficial to you guys for preparation, if you feel like you need it. It offers like a practice test in the beginning, and then screens what areas you might need strength in, and gives you the most practice questions based off the areas it identified that you are weak in. So it really helped me, because math is just not my strong suit, and it really helped bring that score up on my GRE. So that I would definitely recommend that for you guys as a tool to help you succeed in the GRE. As far as healthcare hours, I can only imagine that it is even more difficult now for you guys to obtain those, and it breaks my heart, because I know it's already difficult when so many people are trying to get healthcare hours, and now we have COVID, and sites are limited to who's letting students shadow and such. And so I know that I resonate with you guys that it's difficult to do that, but I will harp it time and time again. I think that is the most important part of your application, specifically for PA school, because in PA school, the curriculum is so condensed and so fast tracked that the best way someone put it one time was that you learn everything that medical students learn, just not at the same depth that medical students learned it at. So what they learn in 4 years, you're learning everything the same, just not the same depth, always at the same time, like to the same extent. But because you're covering everything so fast, typically a 12-month didactic period is what most programs have. You have to have had prior healthcare experience, and schools want to see that, because they don't have time to teach you a lot of the ancillary things that are a part of healthcare, if that makes sense. So it's extremely, extremely important that you have those healthcare hours. And I know CASPA and a lot of schools put an emphasis on direct patient care. That means in contact with patients. So I listed some examples of some there. There are others that a lot of schools will credit for hours, but also you need to reach out to schools to see if they'll accept certain things. I know that some schools won't accept phlebotomy, unfortunately, because they don't consider it direct patient contact care. So just be wary of that, and make sure that you're communicating with schools on if your healthcare hours are actually going to qualify for their direct patient contact requirements. Again, I listed there arguably the factor that's going to make you the most competitive. And I would recommend that about 1,000 hours. That might be a little bit aggressive, and I understand that might be a little bit intimidating. But for example, Rush at the time of my application had, it was either 1,750 to 2,000 hours minimum. So it's just what the schools require, and they really want to see this level of experience prior to PA school because of the rigor of the curriculum when you enter. So I think 500 minimum should be your goal. I won't really waver from that. I think from what I've seen and from the programs I've talked to and our own program, 500 is going to be a minimum of what's going to make you most competitive for applying to PA school. Or make you competitive, and then 1,000 hours is really going to kind of kick you up to that next notch. GPA, I don't want to harp on it again. Schools will vary on what they accept. It's all about doing well in school, you guys, and it's okay to have some classes that you didn't do extremely well in. I'll be the first to say I had a C in Chemistry 101, and I'm in PA school, second year. So GPA is not everything, and I don't want you to break your necks and kill yourself over, or like, sorry, that was not the correct terminology I want to use. Just like strain yourself on like trying to get the perfect GPA, mainly because you think that's the most important part of an application, because in my opinion, it's not. And from what I've seen, it's not. So I think your science GPA is definitely something I would focus more on. That's where you want to show off that you obviously are applying to pursue a master's of science in PA studies. So having your science GPA a little bit higher, more important. But a lot of schools do require passing grades in the prerequisite courses they have listed. So do make sure you keep an eye on how you're doing in those classes, because if you have a failing grade in a prerequisite class, it may not be accepted or satisfy that requirement for that program. So again, your goal should be to remain competitive, but do well in your classes. Take care of yourself. The biggest part of this is being an overall good applicant. And it sounds cheesy and sounds cliche, but I would say that my application profile was pretty exemplary of that. I didn't have the best GPA in my opinion, but I compensated for that with healthcare experience and healthcare hours and personal statement as well. So interviews, a lot of PA schools are switching to the MMI format versus the traditional format. The MMI stands for mini, what does it stand? Mini medical, maybe it's mini medical interview? Guys, I don't know why I'm blanking on that, I'm sorry. But the MMIs are essentially scenario-based interview. They have like 10 to 12 stations set up typically, and a lot of it is these questions in which you have about 10 minutes to respond, and you don't know the prompts beforehand, and they're scenario-based questions. So it's a much more of an assessment about your medical decision making, your healthcare experience. Personally, I think they're fun. 3 out of my 4 interviews were MMI, and I think I excelled in all of those way more as opposed to a traditional interview, because when they ask you a question, you are able to pull off of your actual experiences. You're able to talk about, you're able to answer the question with your experiences. And it's much less intimidating than the traditional interview, in my opinion, in which, what are your strengths? What are your weaknesses? Why our program? They're able to get those answers via how you answer these MMI scenario-based questions. And you can actually Google a lot. You can Google MMI practice questions, and there's some examples of what those scenario-based questions might look like. Sometimes a lot of programs, I know Rush had a one-on-one personal interview, about a 15-minute personal interview where you're able to dive more into those. Why Rush? Tell us more about this, etc. So I would brush up on your CASPA application and reread your personal statement, because if there's questions asked about those, you want to be prepared to answer them. And then you have your personal statement. So that's really your, obviously your time to showcase yourself. And one of the biggest pitfalls, because usually in CASPA, the only personal statement question is, why do you want to go to PA school? Or why do you want to become a PA? And a lot of people have a pitfall here because they miss that this is specifically asking about PA guys. And I've actually read a lot of personal statements while helping with the interview process. And some people don't answer the question. It's, oh, I didn't, they'll say, write a diatribe about how they didn't get into medical school, or they're trying for nursing school, or it's a lot of miscellaneous material. They specifically want to know why PA, guys. So why PA? Why not MD? Why not nursing school? Why not PT, OT? Why not another health profession? Why specifically PA? What about becoming a PA intrigues you? Why do you think you would be a good PA specifically? So the biggest strength to your personal statement is going to be pulling from your personal experiences. That was a mistake I didn't do in my first application. Again, I was one of those people that was just very generic in my personal statement. And my second one, I specifically talked about my medical experience working for my internal medicine physician. I specifically talked about my experience working under the PA. What did I learn from that PA? How did I observe that PA's working style was, how she collaborated with other individuals, et cetera, et cetera. So really pulling off personal experiences and specifically tying that back into the question about why you want to be a PA is going to be critically important. So one of the questions you guys asked me, or you wanted to know, is why PA for me specifically? And I listed a comparison and attached that here in a chart, comparing like a few different healthcare practitioners and how they differ. So if you guys want to take a look at that, but my personal stake in wanting to become a PA was decreased length of schooling. I did not want to be in school for almost 11 years, 10 plus years, especially depending on what type of residency or fellowship you would want to dive into. I wanted the ability to change specialties. That's something unique to becoming a PA. I don't know if you guys knew this, but PAs you're trained as generalist and you don't specialize in a field of medicine. So I could graduate and I get certified as a PA, certified PA, and then I could go start working in emergency medicine and say I have a family at that time and we want to move and we're now in a rural area and now I'm working in family medicine. I could immediately start working in family medicine the next day. Would it be a difficult transition? Probably, from emergency medicine to family medicine, but you guys kind of get the point. There's a lot of horizontal mobility within the field with changing specialties. So that's something extremely unique because you don't have to go back to school and go through an entirely new residency and or fellowship just to change specialties. So it's a huge benefit. And the anticipated work-life balance. Guys, PAs, especially from what I've seen, Rush is a medical center that utilizes PAs to their best ability. It's awesome to be here and to see how they use APPs, which are advanced practice providers, which include PAs and NPs. They utilize them so well. And to see their schedule, they get all the benefits of getting to practice medicine and the best hours. They get their 9 to 5. They get to do surgery and then go to clinic and they get to go home at 5. So there's a ton of benefits as to why becoming a PA was right for me. And I think that you can continue to do your own research. You can take my opinion into account about why it might be right for you. And I've not turned back a single second about this decision. I've absolutely loved it since I pursued it and since I've been in it. It's been the most incredible journey, in my opinion. And I included this here. The best thing, guys, the PA was actually named the best overall job of 2021. It was third in 2020, and now it's number 1 in 2021. It's number 1 healthcare job, number 1 overall job, which is so exciting that the projection for the growth of this field is just continually rising up and up. And so I think that this is a promising time to pursue becoming a PA if that's what you want to do. There's not a better time to do it other than now. Is there a question in the chat? Ruby, I actually saw it. I'm proud of myself for seeing it. Can you specialize if you want, and how do you go about that? Ruby, yes. So, oops, didn't mean to click that. How do I minimize the chat? Sorry, guys. There we go. Okay. So, Ruby, yes, you can specialize. So, and I'll talk about this actually next. Most PA programs are actually 24 months long, 12 months didactic, and 12 months clinical rotations. And you're trained as a generalist, so you have to do all of your core rotations. That 12-month core rotations, which I listed on the slide here, and I'll talk about that in a second, are you have 4 to 6 weeks, depending on what the program length is, and all of those core areas of medicine, you have to do those. Following graduation, there are residencies, PA residencies offered in some programs, and they're very limited, or some specialties. Orthopedic surgery has one. I believe most surgical subspecialties, if that's what you wanted to pursue, I believe they have a PA residency, which range from 12, an additional 12 to 16 months, I think, from what I've seen. So it is possible if you really wanted additional education and wanted to further specialize in an area of medicine prior to practicing, those are available to PAs. They're just not mandatory. So that's something that makes it different from becoming an MD or pursuing, or MD or DO, is it's not mandatory to do a residency to start practicing medicine because you're trained as a generalist. So I would just do research based on if you apply to PA school and you get in and you feel like you're definitely in tune with the specialty and there's something you want to pursue further. I would do some research as to maybe which programs across the country offer a PA residency in that area of medicine that you wish to maybe specialize in. Looks like I saw another. I hope I answered that question, Ruby. So if you have another one, please let me know. Jaslyn, I also have a question. Jaslyn, that's a good question. I think that they are. I can't remember. I might have grouped them together accidentally, so I'm sorry if I did that because it's been a minute since I did the application, remembering all the terminology. I think they very well might be. I think healthcare hours maybe also include volunteer hours and non-direct patient contact care, and then direct patient contact care is considered, like I was mentioning, medical assistant, nurse aide, nurse assistant, CNA, nurse. All of those. Direct patient contact care is probably a separate category. So I would say yes to that. I think they are different. So check on what schools you're applying to and see if their requirements are different from healthcare hours or direct patient contact care as well. So sorry, I didn't mention that earlier. I think that, yeah, that is a excellent clarification. I think I may have forgotten that since I applied. So why rush? I'll try to keep this as short as sweet as possible, guys, because I absolutely love this program and I love living in the city so much, and I could talk about it forever. So Rush is a small class size, only 30. Those PA programs are actually about 70 to 100. So Rush is unique in the fact that it's a small cohort size. I really like this because this places an emphasis on collaborative learning, which is pretty much one of the pillars that the PA profession hinges on. A lot of collaborative learning with multiple interdisciplinary teams like PAs and other PAs, MDs, and OTs, PTs. So I would entices you. I have a great working relationship with all of our faculty. I really feel supported by them. I have a meeting with my advisor almost once a month, and just to catch up and talk about how our rotation's going and such like that. And I really feel like they know me, and they know me as a person, they know me as a future provider. And that's incredibly important, I think, for establishing and maintaining these professional relationships long term. I'm really close with all 30 of my, all 29 of my my other class members. Luckily, we haven't lost any, so fingers crossed on that. Everyone's still together, and I love all of them. I don't sadly see them as much while we're all on rotations and in different sites now, and I really miss seeing them. But every time I do, I'm super excited to see them. It was definitely a journey to be with them every single day consecutively for essentially 12 months in one room, just one room, same room every day. So Rush is actually a 30-month program versus the standard 24-month program that I mentioned earlier. This was super important to me because they have actually a elongated clinical curriculum. So we have 12-month didactic curriculum, and I listed some of the courses that you can expect to take during most of your didactic year, which would be pharmacology, clinical skills. You learn how to perform a history and physical on a patient. You learn physical exam skills on a patient. You learn interpreting labs. What does each individual lab mean? And then we have something called diagnostic reasoning, which actually was a course in, you would get a patient presentation, you would decide what you wanted to order, you would do a full history on the patient, and then it was like a simulated experience, and we'd have like a case every week, and it was super hands-on and really helped us learn and actually put into action and into work what we were learning, because a lot of the time during your didactic year, you're not touching or seeing patients, and it can be kind of difficult to really remember why you're going through PA school. It can be exhausting. So that class was I don't know whether it was unique to Rush, but I really enjoyed it specifically because it helped us put to test what we were actually learning in the didactic material. So like I said, Rush has an 18-month clinical curriculum. You have 12 months, your standard 12 months of your clinical core rotations. That includes psychiatry, geriatrics, general surgery, emergency medicine, women's health, internal medicine, pediatrics, and family medicine. And you also get 2 electives within that. So those are mandatory. You have to do all of them. And all of ours they're all 4-week rotations, or they all 4-week rotations, and general surgery and internal medicine used to be 8, but because of COVID, ours got cut down to 4 because we actually lost about 3 or 4 months of clinical time this summer because of COVID. But so all those normally are 4, other than general surgery and internal medicine being 8 weeks long. Your electives are 4 weeks long as well. And Rush allows us to go out of state for our electives, which is super important for me because I'm from Texas and I want to go home and get out of this cold, you guys. It is absolutely freezing up here. So I'm actually doing my second elective with an orthopedic surgeon at the end of May, and I'm super excited about that. I get to go out of state now that I'm vaccinated, and I have a 2-week break after that, so I get to quarantine upon returning. So super, super excited about that. And then we get our 6-month specialized track, and guys, I get to find out my my track on Friday, so I'm super excited. I preferred orthopedic surgery. If you hadn't already told, that's what I was leaning towards. But something super special about Rush is that they actually offer a ton of tracks that a lot of schools don't offer. And so not only do you get an additional 6 months of clinical training in a specialized field of medicine that you want to go to. So Ruby, like some programs have this. And to your question earlier, Rush has essentially a built-in residency because of this additional 6 months of clinical training. And so Rush offers orthopedic surgery, cardiothoracic surgery, medical oncology, physical medicine and rehabilitation. They even have cardiothoracic surgery, I think pediatric endocrinology even. So really there's a specialty of medicine because of the resources we have being at a medical center. They're available to you to pursue as a whole third year of medicine. So if I get orthopedic surgery as my track on Friday, which I anticipate that I will, my last 6 months of clinical training will just be orthopedic surgery. So you can imagine, as someone who wants to go into that field and wants to go into a surgical subspecialty, 6 months of just that type of medicine is going to be super beneficial. And I'm going to feel a lot more competent as a practicing PA when I start practicing, and feel so much more comfortable in an OR, as opposed to only the 4 to 8 weeks and plus elective time that I would have had in a 12-month didactic or 12-month clinical curriculum program. So Rush also had a consecutive 100% first time pass rate last time I checked, which is super encouraging. That means that every student that's taken the PANCE has passed. And obviously you want that as a prospective student. You want to know that your program is going to have the right level of education to prepare you for your board so you can pass the first time and then start practicing medicine. The location, Chicago, guys, Chicago, I might be biased, but it's one of the best cities, in my opinion, in the world. I think that there's not a shortage of things to do in the city. The summers are to die for. You cannot beat them. And it makes the rigors of this program worth it and doable, because I'm able to balance social life and going out to the beach and going to the lake during the summer, and free concerts, free music and food, and balance just being happy while also going through this program and really just enduring a rigorous education. And the most important thing, in my opinion, though, is the fact that we are integrated with one of the top medical centers in the country. When COVID actually started, just as a little anecdote, Rush was was the command center for for COVID intervention and communication. We were piloting a lot of the decision making and the protocol that was used to dictate how COVID was treated and how COVID was managed. So it's extremely awesome to be around all of these providers, and I feel so encouraged daily because I'm around some of the best people who are practicing in their field, and I'm around all sorts of providers, tons of PAs, tons of NPs, that it helps for me to see prospectively what does this working environment look like with PAs and MDs and NPs and all this sort. I think sometimes if you're not in a setting in which you get to see that, it might be hard for you to visualize what that working environment will be like for you in the future and how well you might fare in that environment. So During our didactic year, we actually have lecturers from the medical center and all over the city of Chicago come and give lectures to us. And so we get the best people in the top people in their fields coming to give us lectures about heart failure, about interventions with kidney transplants, et cetera. And it goes on and on. And I think my education was so comprehensive and so holistic during my didactic curriculum because I was at Rush. And I think I was so lucky to have that. And I think that's something super special to this program. So now that I'm done talking y'all's ear off for the most part, thanks for bearing with me, guys. I know I can talk a lot. This might have been overkill on a presentation, but I wanted to make sure that you guys were as prepared as possible for heading into possibly applying to PA school or possibly pursuing another another health profession. In the end, guys, you have to find what healthcare profession fits for you. PA was the right fit for me because of where I was at in my education. I didn't want to pursue a super long education. I wanted to be financially comfortable with a profession that does have financial benefits, but I also wanted work-life balance. I knew that I wanted to have mobility within my career. I wanted the ability to actually go into surgery without having to, again, pursue even longer school. So you just have to find what's right for you because they're all different. They all have their pros and they all have their cons. Use your personal statement to stand out. I wanted to harp on that again, guys. Use your personal experiences and answer the question. Don't forget to answer the question. Why do you want to go to PA school and why do you want to become a PA? Again, healthcare hours are arguably the most imperative part of your application, in my opinion, because for PA school specifically, they want to see that you're prepared. They want to see that you guys know what it means to be a healthcare provider before you apply to school. So I think that's the most important thing because they don't have time to teach you a lot of these things prior to you entering PA school. And if you don't have that level of experience, you might feel like you're behind and it might be more difficult for you of a journey if you're in PA school with a lower number of healthcare hours than maybe other applicants would have. And lastly, this process is incredibly tough and it is exhausting. I don't want to beat around the bush with that, guys. That's just the reality of how it is. It's a full-time job and that can be really difficult to do when you guys are in school, but it's worth it. And I think if that's what you want to pursue, you should go for 100% and don't give up. It took me 2 tries to do it. So let that be encouragement to you guys that it's possible and that this is such a competitive process that maybe even if you don't get in on the first time, it's not that your stats weren't all there. Sometimes there are just so many competitive applicants and I don't want you to take that personally as tough as it can be. Really just look introspectively if that happens to you and find out, what can I do to improve my application? Or maybe if you even want to take a gap year and be like, what can I improve to make me more competitive for the next year? Then do that. There's no perfect timeline for anyone. And I think comparison is going to be the greatest thief of joy in this instance. Don't always look at what other people are doing. Maybe my journey and my personal anecdotes aren't, what the process is going to look like for you. So use other people's commentary and experiences as motivation and to help change and add to your application to make you more competitive, but don't think that your timeline is going to look exactly like someone else's might. So with that, guys, I'll give you my email here. Oh, and I included some helpful resource links. There's a Facebook page that I'm a part of that pre-PA students and PA students are a part of. It's a hugely incredible resource. I didn't know about it until I became a PA student. I really wish I would have. The notifications can be really annoying. I will let you know because so many people are talking about it, but I think it's so helpful as a pre-PA student. I would have wanted to know all these communications that everyone are talking about if I was applying to PA school, if I were a part of that group. So I would want to know. Excuse me. So use that to your advantage if you're thinking about becoming or applying to PA school. The other ones are to find programs that might work for you or programs that you're interested in and fit your application requirements and desires to go based on location. And then the American Academy of PA websites, I would look at that because a lot of the up-to-date literature about what's going on within the profession is super important to know about prior to going into your interviews. I happen to get this I happen to get this recommendation that I should look up what OTP is. It's a policy called optimal team practice that the PA profession was trying to push for, and is still trying to push for on a national level, that emphasizes collaboration with all healthcare providers. And I brushed up on that prior to my Rush interview, and I actually was able to use that as a part of one of my MMI scenarios. So multiple mini interview. I'm sorry, guys. I totally just remembered that. Can you tell it's been a long day? I'm sorry. So multiple mini interview, that's what that MMI stands for. But that's super helpful to brush up on prior to your interviews to help boost your confidence in answering those questions and doing well in those scenarios. And then I listed the link to the PA CAT if you guys want to take a look at that as well. But again, I don't have much intel on that, so I apologize. Here is my email. Please, please, please email me if you guys have questions. Just be cognizant of the fact that I am still on rotations and I'm still very much in school, and it might take me a minute to get back to you, but I definitely plan on getting back to you based off of what questions or additional questions you have. So please don't feel scared or hesitant to reach out to me at all, because I've been through this process. I know what this is like, and it's my joy to help people through this, because I've been there and I had help, and I want to give back and help people who are also going through the same thing. So without further ado, guys, that's all I have for you. So if you have any questions, please, you don't have to type them in the chat anymore unless you want to. You can just unmute your mic and ask me. But I hope that this was helpful for you guys.
Thank you, Carson. That was so much information.
Yeah, I know. I'm sorry.
There's a question from Ruby in the chat.
Oh yeah, I'm seeing it now. Yes, Ruby, that is completely correct. In medical school, you a lot of the time, based on how you do on step 1, step 2, step 2 clinical skills, and on all of those tests that you complete prior to completing your 4th year of medical school, which do dictate a lot of the times what specialties you're eligible to apply to. PA school, for us, when we got to rank what specialty we wanted to do for our 6-month track, it was completely based off personal preference, and they don't factor in our grades during didactic year. They don't factor in how well we're doing on our rotations, what our evaluations look like. It's all based off of what you specifically wanted to do and how many people are wanting to go into that specialty. Like if there's 12 people in my class who wanted to go into emergency medicine, they might not all be able to appease all of those requests, mainly because they just don't have that many spots for 6 months worth of 12 students in emergency medicine placements. So that would be the only thing that would stipulate that. That's why they have you rank 3 choices, based, so that way if you don't get your first choice, you might get your second. So yes, that's something that's awesome about PA school, is you get to do what the specialty that you want to do, and you're not barred maybe because you didn't do too well on diagnostic reasoning 1 in your fall semester. So it's a super beneficial part of PA school.
So I have a list of questions that some people had sent in. Is it okay if I just read them off to you?
Yeah, absolutely.
Okay, so the first one, how would you suggest finding PAs to shadow?
Oh, that's a great question. And unfortunately, I wish I had better recommendations for how to accomplish that. The Facebook page I recommended, I think that's a great place to start. There's PA students and actual PAs and pre-PA students from all across the country who post in that group often, and even preceptors who are looking for students. So that's a great resource to use. Reddit, actually, I've heard. I don't know how familiar people are with using Reddit. I'm not even that familiar myself, but there are forums and there are threads about preceptors looking for PA students, or how you can actually get connected with PA students. My only other recommendation for that was just see what your school has to offer. I'm not sure all the resources you guys have, but at Rush, we actually had we had a similar pre-health club, and a lot of former students that were now in PA school or now were actual PAs would connect with pre-PA students through that group. So I would use all those resources that you can, but the best two I would suggest would be the Facebook group that I mentioned in my PowerPoint, and then a Reddit threads, to be honest with you.
Alrighty. Thank you. It's really hard
Yeah.
trying to find stuff for pre-med too, especially with COVID. It's like
Yeah.
the little opportunities that there were before just like shrunk.
I know, and I feel for you guys, because I really can only imagine. I've talked at length with a lot of my friends about how much more difficult it is now because of the situation we're in with COVID for you guys to have access to those types of healthcare experience and that direct patient care. You really have to try hard to find what you can. And I think with that comes the fact that schools are a little bit more lenient as to what they might accept as direct patient care during this time. So maybe if they didn't previously accept phlebotomy, maybe they will now, because it counts as healthcare hours. So just a lot of that is changing daily and monthly on what schools are requiring as this situation continues to adapt and change. So just continue to reach out to those schools and see what their requirements are.
Oh, speaking of COVID, how has COVID impacted your experience with PA school and like getting to learn everything?
Oh, it's been a doozy. It has really been a doozy. We were in our last month of didactic curriculum in March. We were going to be done in the middle of April, and then spring break, the second week of March, we got pulled off of campus, and then we were told that we couldn't come to campus. We were going to finish the rest of our didactics online. And so we did, and then COVID obviously continued to develop into the situation that it is now, and we ended up being off of clinical rotations until September. So we missed 3 to 4 months of rotation time, and luckily our school tried our best to continue to preserve our graduation date, which is December 2021, which we still have, thank goodness, because I'm not looking to pay any more money. I'll tell you guys that. They preserved our graduation date, but like I said, our internal medicine was cut down from 8 weeks to 4 weeks. Our general surgery rotation was cut down from 8 weeks to 4 weeks. Our geriatrics and our psychiatry rotations were cut down from 4 weeks respectively and combined into 2 weeks each into 1 4-week rotation. So they did this all within conjunction of what the overarching PA Education Association body deemed appropriate to do without sacrificing too much of your education. But we were worried for a second that if we lost any more clinical time, we were going to have our graduation delayed. So as of right now, knock on wood, things are going well. People are continuing to get vaccinated, and the situation seems to be improving. So as far as being on rotations now, ever since we started back, I haven't had any issues. We just have to make sure that we're in our full PPE equipment when we're going in to see COVID patients. Actually, I'm on a COVID unit now at Rush. On my internal medicine rotation, and so I see COVID patients every day.
Is it scary for you?
It was definitely at first, and I've been very fortunate that I haven't seen, excuse me, a lot of critical care patients. That hadn't been my experience. I've been fortunate to not see that, but also it's a big shock for me when I was working in the ED, and I did see some patients decompensate ultimately and pass away from complications due to COVID. I'm generally a happy person, but I will say that the cold weather in conjunction with the not optimal daylight and having to see some of these COVID patients, sometimes they can wear on you. So you have to make sure that you have, especially going through a program like this, have to make sure you have the support system in place that's going to support you guys, and you can't lose the things that you find joy from. So if really, like for me, exercising, sometimes I just won't study because I'm like, I just need to go exercise and I need to watch Netflix tonight. And I do not let myself feel bad about it. That was one thing I did not let myself do, because I'm like, you have to do these things for yourself to invest in your own health care and well-being in order to make sure that you're able to give to these patients when you see them.
So would you say that like mental health is like your own mental health is like a top priority throughout all of this?
Yeah, I absolutely would. And I think that anyone who applies to any sort of professional school, it has to be your mental well-being and your own personal well-being have to be your priority at all times. And it can be difficult to do that. I'm not saying that I always had that as my priority, but living in Chicago, it's really that has actually made it easier for me to do. During the summer, when I was in my first semester of PA school, I was dying, y'all. I was like, this is so hard. I was just drowning. But on the weekends, I was like, I'm gonna go to the beach. I'm not gonna study maybe on Saturday, or like maybe I'm gonna go to the beach during the day and then I'll study at night. And I found that I did better when I didn't just study all weekend and lock myself in a coffee shop and didn't go talk to anyone and just studied. That was not beneficial for me. I had to go to the beach and play volleyball and meet people. I had to go swim. And so that has to be your priority in school. And I found that that has actually made me way more successful rather than do this, study all the time, study all the time. I've got to do well on this test, et cetera, et cetera.
That's really good advice. I definitely find myself like drowning in books more than half of the time.
And it's way easier said than done to do that. And a lot of it's just a learning experience of learning how to balance that. But um, you have to realize that, this isn't, when I come home, I don't want PA school to be everything for me. And that was one of the biggest things when I started school. Yes, I'm excited to be here. And yes, this is the most important thing that I'm doing right now, but it is not, and it cannot be everything, because it will consume me because of my personality, just to want to do well and to want to be the best at what you're doing. I get that. But these experiences, especially being in school like this, can completely overtake you if you don't ground yourself in like the actual in reality. It's like, what brings you joy? If your family brings you joy, maintain those relationships, continue to talk to your friends, go have sushi one night with your friends. Like, it's okay to do those things and to make those sacrifices. Now, should you be doing that every night and pushing off studying? Probably not. So it's a constant learning it's a constant learning battle. Especially during my first semester, I was definitely teetering back and forth between, okay, what's working and what's not working. I didn't do well studying on my own. I studied way better in groups. I studied better bouncing ideas off of people. And that's not something I actually did prior to PA school. I was much better studying on my own. But in PA school, why not? I have 29 other people around me who have all of these backgrounds in healthcare and all these backgrounds in various areas of medicine. If maybe I'm not understanding chronic congestive heart failure, why don't I ask someone who was literally a cardiac ICU nurse? And so using your peers around you is so beneficial. And I will say, I didn't mention this in my PowerPoint. One of the benefits of, especially at Rush and PA school, there is no competition. We're not ranked against each other. Our rotations, what order they're in, what specialty you get, are not based off of your evaluations, are not based off of your grades. And so removing that air of competition, it only further emphasizes the collaborative nature of the PA profession, especially at Rush. I've never one time felt like I was in competition with any of my classmates from the very first day of school. And I think that's something so unique, because our entire life applying to these pre-health programs is competition. And I get that. So it's like weird at first, because you're like, why don't I have to be on edge competing with everyone? And it's the most refreshing thing in the world. I have some of my favorite relationships with people, primarily because I'm so encouraged by their intelligence, and I feel like I'm a better student and a better provider because of the people I'm around. If I don't know the answer and someone else does, because of this experience, I don't feel less competent because I didn't know the answer. I'm like, that was a great suggestion. I'm gonna take that and think about, like, why was I thinking about that before, and how can I change that to be better next time?
That's really awesome that you feel like a whole team, like just one unit, just that makes each other better. I really like the idea of that.
I think that's something super unique to the PA profession and PA school, because medical school, just with the nature, and I'm not bashing on, medical school or nursing school or NP school, because I love working with all those providers. I really, really do. But for me specifically, I work best when I'm in a team. My entire work experience, even as a swim coach, growing up as an athlete, I've always been a team-based person. And so we had a simulation activity the other day, and I was with four other students in a simulated activity where like our faculty was behind glass, and we had a mannequin that like is a super high tech mannequin and can do a bunch of things, and you can actually listen to heart sounds on the mannequin. It can like show hives. It's actually crazy. But well, I got to work as a team with my other students, and there were times that I'm like, I don't know what I would have done there. And my one of my other teammates was like, my classmates was like, hey, this is what we should do. This is the medicine we should be considering. And there was times that I was like, hey, this is what we need to be ordering. What we need to be asking the patient these history questions. Where this is our differential. So, and I stepped out of that experience and I was like, gosh, I love you guys. I love working with you guys. I just feel like I don't always have to have the answer, and that's what collaboration is about. And using this experience to become a better student and a better provider. I'm constantly just encouraged and like enamored. I really am in love with all my cohort. I'm like, you guys are so smart.
Oh, so earlier you mentioned that you were one of the people that look over all the applications. So what makes an application stand out to you? Like, what do you suggest that we include in our applications?
Yeah. So healthcare hours, number one. That's so important. That's one of the first things that their eyes will go to. Like what does your healthcare experience look like? Where did you do it? Who did you do it under? What field of medicine did you do it under? That's not like, I'm not saying that they favor family medicine over internal medicine. I'm just saying like maybe they're like, that you worked in pediatric oncology for 12 months as a medical assistant. That's super unique. Did they talk about that in their personal statement? So that's definitely something you want to make sure you highlight on and explain in detail when you're describing those healthcare experiences. What exactly did you do? I wouldn't just say took vitals and saw patients. That like, I would nitty gritty. What did you do? I took vitals. I took blood pressure. I triaged patients. I called patients with results. I helped physician/PA interpret results and talk to patients regarding medical education. Explain all those things that you did in detail, because it's only going to be beneficial to you. And your personal statement. I cannot tell you how many times you guys, and how do I want to phrase this? This isn't about, if you have a story, because that story is unique to you, use that story. But I guarantee you that we can tell when we're reading an application and it's like, this is completely dramatized, or you're like, this is not, it doesn't make sense. So, yes, you want to stand out, but you stand out by having an equipped knowledge of the PA profession. Let that shine through your personal statement, because it's also very easy to tell when someone doesn't know that they want to go to PA school and they don't really know about the profession. It's very easy to tell that. So make sure that you know about the PA profession. One of the tips I'll give you guys, don't say physician's assistant. That's going to be an automatic, like, it's not, because that's not the name of our profession. It's not physician's assistant. We're not an assistant to the physician. And a lot of people do that, even if it's a spelling error, but it's almost like an immediate, like, A, you didn't decide to look through your application for spelling errors, and B, you clearly weren't paying attention to your application. So instead of physician assistant, say PA, because we actually just had like a survey about a name change of our profession. And so they're trying to even move away from physician assistant, because a lot of people do associate with assistant as some sort of lower level provider, which is not the case. And so there was actually a giant survey and possible movement, which they're still tallying the results of whether the name of our profession might change. So use PA when you're referring to physician assistant. Talk about policies. Like I said, look on the AAPA website. Talk about there's a lot of issues right now, guys, in certain states. For example, not every state has the same scope of practice as all the other states. Texas is luckily one of the states that has one of the widest scopes of practice for PAs, but in some states, they can't prescribe controlled medications. And when I say that's within the scope of a PA to do, but like say Wisconsin doesn't let practicing PAs do that, that's a problem. And so maybe you want to talk about how you're passionate about the legislation towards moving for a wider scope of practice nationally for PAs. So these are the types of things you really want to invest yourself in and show that you have a knowledge about what the current literature is about PAs, if that's the path that you want to choose. Or medical students, look into that. What about the profession is happening? Maybe a physician shortage, etc. So look at issues based on what health profession you want to pursue and try to weave that into your personal statement.
That's a good tip. Current events are always such a hot topic to talk about. Like there's never enough to say.
Yeah, absolutely. And it seems like, oh, like I don't want to be cheesy, talk about current events. No, I'm telling you guys, everyone eats that up because you seem so educated about the profession, why you're here, why specifically this profession. It's very evident when applicants are ready for their interview and prepared to answer these questions.
One last question. Sorry, we're taking up so much time.
Oh no, like I said, all my time is yours. I'm sorry if I'm holding everyone hostage with answering these questions, but I hope it's helpful at the least.
It's all really valuable information. Like I definitely did not know 99% of this beforehand, just because I don't know anything about PA school.
Well, I'm glad to help.
So it says here that we are supposed to apply very early, so about a year and a half or so in advance. So do we need to have all the requirements completed prior to applying, or can we continue gaining hours and like course requirements during the year that we're waiting to start PA school?
Yeah, great question. So say for example, you're a junior, or I'm not necessarily a junior, but you're a senior. So say you're applying because you want to start PA school next. When did I start? I started in the summer. So I applied in April for the following summer. And at the time of application, so this is actually a great point to make. When you submit your application for verification, you can still update it after, and you should update it if you have stuff to update. So don't delay. So if you are ready to submit your application, say first week of June, like I said, right? That's really what you want to shoot for at the latest. Say you're ready, but you're like, oh my gosh, I don't have this prereq course done yet because I'm taking a summer course and it's not done until August. Denote that on your application that you're still enrolled in that course, and then submit your application, still get it verified through the process, and then follow up with the school and let them know what's still pending. That might actually only go for coursework, because I know that for Rush, when I submitted my application, I was automatically denied because I didn't have the amount of healthcare hours. So that might only be for some requirements, meaning that like if they get your application, because a lot of it goes through screening, right? So if they see that your application, their minimum requirement for healthcare hours was 1,500 and you have 500 documented, boom, it might eliminate the app. So that might only apply to prereq courses, not. But what I will say is that's if you're under the requirements. However, say you're at, the requirement was 1,500 and you have 1,600. Well, say you want to continue to update your app, you can continue to do that after. I think you just have to be wary of not meeting requirements beforehand when specifically pertaining to healthcare hours and direct patient contact care, if that makes sense.
Okay, that makes sense. So like you probably have all your healthcare patient hours beforehand, but then your courses that you're already enrolled in, that can just be like notated on your application.
Yep. So you can still apply before you've graduated, and they're all pending your completion of the grades of those courses. So they'll factor that in. But the healthcare hours, that's one of those things where, like, say, I would just continue to update that as you get them in your application, because you can do that after it's verified. Okay. At least with CASPA. So
are most PA schools on the CASPA system?
Almost all of them are. I would venture to say, because it's a centralized application base. Like imagine Apply Texas, right? Apply Texas for undergrad is what CASPA is for the nation for PA schools. Okay. And I'm almost positive, like if you're not on CASPA, you're probably decreasing your chances of getting applicants, or like, you know what I'm saying? Because that's just a centralized database that everyone's going to use. So it would be more beneficial for a PA program to use CASPA for ease of access for applicants. So I would anticipate that, I mean, nearly 100% of programs are on CASPA.
Okay, I know med schools have the same. It's like or for Texas at least, it's like the TMDSAS or some weird.
Yeah.
Um. Okay, so this is my personal question. So do most people have a gap year in between undergrad and PA school? Because the 1,500 hours or so, that's approximately like almost a year of working 40-hour weeks. Like it's really difficult to get all that in while you're in school.
Yeah, it is. It's and so that's why I say this journey looks different for a lot of people. But I will tell you, the average age of the PA student nationally currently is 27 when starting school. That's not to discourage you. That's just the national number. I was 24 when I started. So, you know, if you're not able to get that healthcare experience during your undergrad, which it's difficult to do that, again, you don't have to be rushed on any timeline. You're still so young, and you still have time to apply. So if you need to take that year to gain those experience, what I want to say is that you would be so much better off using that time to work and get that experience and find an experience that's going to stick and gain you those direct patient contact hours, rather than shooting an application off and wasting all that money if you're not that competitive. Do you know what I'm saying? Like, if you're like, oh, I have 400 hours. That's what I did my first time. I was not briefed fully on what this application process looked like. I didn't know how many schools I should apply to, and I just wasn't as competitive. And to be honest with you, in retrospect, I'm like, that was like $3,000. Like I cannot do that again. So you want to be prepared when you're doing this, when you're applying, even if that means waiting it out and just getting more experience.
Okay, I was on a rush to graduate, but I don't know. Sometimes I feel like I'm not quite ready just because I don't have all those shadowing and internship hours. So I have like the volunteering hours because it's so easy to volunteer in the hospitals. Well, at least a year ago it was. But the paid healthcare experience that PA school requires is so much, but it's so difficult to find without a certification.
Right. And luckily, and I was gonna say, luckily for me, guys, don't be afraid to reach out to these places, because I actually worked as a medical assistant, not certified. I just shot my shot with the connection I had, and he was like, you be my medical assistant, these will be your responsibilities. And I was like, hey, heads up, I'm not a certified medical assistant. Did it kick my ass trying to learn all this stuff about how to triage patients and do all this stuff while as an undergrad, because I knew nothing? Yes, it was not a good summer, but you have to be willing to put yourself out there, because you don't know unless you ask. So you don't always need a certification to do these things. Some places are actually encouraging that they'll take you without a certification, especially for medical assistant. That's one of the best, I think, the best opportunities, if you can, for direct patient contact care. But I know how difficult that is as well. I did also want to say, with the 1,500 hours for Rush, that's not normal. Most schools don't require 1,500 hours. That is definitely on the higher end. Most Texas schools, I believe, are 100 minimum, 500 to be competitive, typically.
Okay, that's
so 1,500. Yeah, I should have said that earlier. That's not the norm, typically.
Okay. Oh, it looks like Ruby's got a question for you.
How is working along MD? Bye, Addison. Yeah, happy to help. You have my email in case you need to email. How is working along MD? Ruby, that's a great question. I've loved it. I really, it's so awesome to see how an interdisciplinary team works together, and especially at a medical center like this. And especially for me wanting to go to PA school, seeing a medical center that utilizes APPs, which are PAs and NPs again, to the height of their top of scope, is exactly what I wanted to see and what I need to see as a student, because I don't want to see, you know, practicing PAs not working at the scope of their practice, because that would be discouraging to me. And then I would question, you know, am I getting the best experience? Is this really the most that I could be doing? So I think that's really important when you're thinking about applying which program in which state, so that you know what those what that scope of practice for PAs in that state looks like. I think that's also something to consider too. So that way you kind of know what education you might be getting if you're going to go to a program in that specific state. Um, I At Rush, everyone works so well as a team. I mean, there's so much respect for APPs, MDs, PTs, everyone. Everyone truly works as a team. They actually have been ranked number one at hospital in patient satisfaction in the country, and that's because they do so well at working together as a team. So I have to go into my future career knowing that that might not always be the case of maybe my place of future employment, but I'm so lucky that my education, I've been able to see this, because that's how I'm raised as a student and raised as a provider, so that I have that expectation. That's how I'm going to treat my future collaborative team. As far as a power struggle goes, there's always going to be those people. There are always going to be those people who think that they're better than you. I have some people that will call us physicians assistant students, and you you pick your battles. I'm not going to fight a battle with someone that calls me a physician's assistant student, or, you know, there's always just going to be those people. But I will say, what's awesome is that it's not the majority of people. That, especially in the healthcare field, I think you will find that's not the majority, especially at Rush. That is the minority by far. And honestly, at Rush specifically, their PA students and their program is so valued that all of my preceptors, when I'm like, oh, hi, my name is Carson, I'm the PA student that's gonna be rotating with you, they're like, oh yes, the PA student. Like, they love PA students. And that's not to say they love med students too, but I've constantly gotten feedback like, we love the PA students.
So I actually have a question now.
Yeah.
This is Jaslyn, that's my name. And you had said that normally the minimum isn't like around 1,500,
Yeah.
but I've been hearing that a good amount to have is actually 2,000 for Texas PA schools. So I'm not sure if you, I guess, have a different view. Like, do you think that's like a good number to have, or maybe they were over exaggerating to just make sure like you had enough or something? Because
Yeah.
I'm actually in the Pre-Physician Assistant Society. I'm an officer for it, and so we've had meetings where we've had like other PA students or PAs come in, like, thoughts about that.
Yeah. So once again, this just goes to show you that healthcare experience hours are the most important part of the application. So that's why I say, when I place the emphasis on that, I think that by far, in my opinion, and clearly it seems like maybe a lot of the feedback on a lot of the other students and PAs that have come to talk to you, that's the general consensus. So when I was applying 2 years ago, or what's it, almost three, I've been three now. It was what I said. It was about 500. That was, and you know, the requirements unfortunately get steeper and more competitive every year. And so I think that when people come and talk to you, that might reflect that. My goal in my PowerPoint presentation, I think 1,500 is probably like, that's going to make you competitive. I think that's the very realistic side of this, is that amount of hours is going to show I have had experience in the healthcare field. I have worked with patients. I know how patient care works, and generally I have an introduction to it. I think that's going to make you strong. When you start to have above 2,000 or above, I think that's the part of your application that you're like, I want you to look at this. This is what makes me strongest. I think 2,000 or above, that's going to be like, wow, this person is, they are competent in what they've done, and this is going to make them a really strong applicant for our program, because they're really trying to assess you guys. Are you going to be able to withstand the rigor of the program? Because there just is not enough time. There's not enough time in 12 months to teach you everything in medicine if you didn't already have a background before. That's why it's so important.
Okay, thank you so much.
Yeah. Sorry if that was a generic response to your question, Jaslyn. I unfortunately don't know in Texas what it looks like because I went out of state and all of my interviews and applications were out of state at that point. So I don't actually, I'm not too familiar, but I will say like a place like Rush. So Rush was 1,500 when I applied 3 years ago. Now it's 2,000. So I think it will unfortunately probably continue to incrementally increase. But I would say that a goal of 1,500 to 2,000 should be your goal. Anything above 2,000 is just going to make you a really strong applicant. And the reason I felt comfortable, or the reason I wanted to have that many hours too, is I had 4,000 by the time of my second. And the reason I think I got 4 interviews and 4 acceptances, honestly, was the healthcare experience. Because like I said, my GPA wasn't anything special. It was a 3.2, and I did a good job on my personal statement, in my opinion, but it was the healthcare hours. I felt so confident in my interviews, talking about my healthcare experience, talking about answering questions based off of my healthcare experience, and et cetera. So I think that's just, it all ties back to that and how crucial it is to the application.
Okay, that definitely makes a lot of sense that the hours probably just have went up also. And I know we did have a PA student that had just graduated PA school, and he actually had a PowerPoint with like statistics on it of like the minimum direct patient care hours required for the school, and then the average patient care hours of people who were admitted. And most of them, the minimum was like maybe 100 hours, but then the actual admittance was like a lot more. So maybe like the 1,500 to 2,000. So I guess that might be another reason
Yeah.
they were saying
And it
that.
could, yeah, I think, and this goes back to being an overall competitive applicant. So there are people, and I know there are people in my class who did not have as many hours as I did. They probably had around 1,500, 1,650, but they had higher GPAs, and maybe they had a better personal statement. So if you feel like you're an overall strong applicant based off of the statistics that you're seeing and how confident you feel in your app, then I wouldn't be discouraged in that. Like it's not a hard line. And I think some people view it that way. It's not. Like for example, I had I forgot, was it, I think around 2,000 hours at my first time of application. I think it was like 1,750. I forget whatever Russia's requirement was. I was like barely under it because I got rejected the first time from that. I still got an interview with a 3.2 GPA. So, and I'm not saying that's bad. Personally, in my opinion, guys, I survived with 3.2. Life is good. I'm in PA school, so that's all that matters. That should be encouraging to you. And I'm doing well and did well in PA school. So don't let that discourage you at all. And there's people who got in with, like, I got an interview with that profile. So I'm not saying, I think sometimes with these hard cutoffs, it can be discouraging. But I will also say, I do want to prepare you for the very real fact that a lot of this sometimes is chance. It's just, it's chance with, did your application line up with what they were looking for? Does the class of people applying, do you fit in with their statistics? Because it's not the same every year, right? Like maybe during COVID, GPAs are a little bit lower, or maybe during COVID, healthcare hours are a little bit lower. So statistics change every year. So I don't ever want you guys to view it as like a hard set line.
Okay, thank you so much.
Yeah. Oh, Alina left. Bye, Alina.
She's got a microbiology test coming up.
Ooh.
So
Yeah, I've kept y'all for almost 90 minutes. So if you have any more questions, you're welcome to ask. I'm not doing anything, but I would hate to keep you guys if you have to go.
Thank you so much for the session. It was very, very informative.
Yeah, awesome, Ruby. I'm glad it was helpful.
Thank you, and have a good one in studies and your rest of your PA program. Thank you.
Thank you, and good luck to you guys.